Hello everyone, welcome to Let's Talk Anatomy. Let's look at part 2 of the gross anatomy of the temporal bone, and in this part we'll be dealing with the petrous part of the temporal bone. So without much more delay, let's go into the petrous part. So this here is the temporal bone. In the last section, or in part 1, which I'll be linking up there, we looked at the different parts of the temporal bone, which are the squamous, the mastoid, the petrous, the tympanic, and the styloid. And we dealt with the squamous, mastoid, tympanic, and the styloid parts. We are left with the petrous part. Then we also learned that the petrous and the mastoid lie in close proximity, and in many textbooks are referred combinedly as petromastoid part of the temporal bone. Now let's look at the petrous part of the temporal bone. This is an interior view of the calvarium. Let us highlight the temporal bone here. And the petrous part is actually a pyramidal horizontal plate of bone which is located on the inner aspect of the temporal bone. So this here is the petrous part. You can appreciate the pyramidal aspect of it, and we can see that in the 3D model also. That is the petrous part. It has got an apex which is directed medially and forwards, and a base which is abutting onto the squamous part and the mastoid parts of the temporal bone. Let's look at the other parts of the petrous bone. There is the apex, there is the base. It has got 3 borders. You can look at the anterior border is over there in green. Then we have the posterior border, and of course we have the superior border. And in between these borders we have 3 surfaces. The anterior surface lies between the anterior and the superior borders over here, and the posterior surface lies between the superior and the posterior borders. In this view we cannot see the inferior surface which is lying underneath. So the inferior surface is underneath these 2 borders. Let us look at the features of each of these parts one by one. In the apex, the main feature that we have to know is that it forms the lateral end of the foramen lacerum. How does that come about? So here we have the foramen magnum and a section of the base of the inner surface of the calvaria, and there we have the apex, and here is the foramen lacerum. And that is how the apex of the petrous bone forms the lateral end of the foramen lacerum. And what it shows or contains is the anterior end or the anterior opening of the carotid canal, which transmits the internal carotid artery. So that is the feature of the apex of the petrous part of the temporal bone. Let's go for the base. The base of the temporal bone merges with the squamous part and the mastoid parts, and it is separated from these 2 by a suture or a fissure known as the petrosquamous fissure. So this fissure may not be present in all bones, but some remnants might be there in some specimens that you might look through. So this is the boundary between the petrous part and the squamous parts. So here we have the petrosquamous fissure. Now let's look at the anterior surface. There are a lot of important features here. The petrous part of the temporal is a little complicated because it houses the hearing and the balance organs as well as many important canals. So let's see the features from before backwards, that is from the anterior to the posterior. From the apex to the base, what are the features that can be identified? Let's first find the boundary between the petrous and the squamous parts by placing the petrosquamous fissure over there. And now let's see, the first impression that we see very close to the apex is the trigeminal impression. It houses the trigeminal ganglion. Behind that we have another elevation which is the arcuate eminence. It lodges the superior or the anterior semicircular canals of the internal ear. Now the next part is called the tegmen tympani. It is the region between the arcuate eminence and the petrosquamous fissure. So the plate of bone lying between these 2 landmarks is the tegmen tympani, and it forms the common roof for the mastoid antrum, the middle ear, and the pharyngotympanic tube, also called the auditory tube or the Eustachian tube. So that is the common roof for the tegmen tympani, is the common roof for all these 3 structures. Now, we have 2 nerve canals also located on the superior surface. Laterally, Slightly anterior to the tegmen tympani, we have the canal and the hiatus, or the opening for the lesser petrosal nerve, which is over there. And medially, we have the canal and hiatus for the greater petrosal nerve. So the lesser petrosal nerve comes out through this canal, and through this hiatus, passes through the canal and goes to the foramen ovale. And the greater petrosal nerve enters the foramen lacerum. Let's look at the features of the posterior part of the petrous temporal bone. There are three important features in this surface. The most important one obviously is the internal acoustic meatus. We'll mark it here. It gives passage to the cranial nerve 7, the cranial nerve 8, and the labyrinthine vessels. The next thing is the opening of the aqueduct of the vestibule, which is a small opening that you can see there, covered by a plate of bone. It lodges the saccule and the ductus endolymphaticus filled with endolymph. So that is the opening of the aqueduct of the vestibule. Now above and behind the internal acoustic meatus, we have a fossa. It is called the subarcuate fossa. It is not distinct in adults, it is more highly distinct in newborns. It usually is covered by a dural process and contains blood vessels. So these are the features of the posterior surface. Now let's look at the features of the inferior surface of the cranial nerve, of the petrous bone. Let's look at the features. Let's just orient ourselves to the anterior, the posterior, the lateral and the medial poles, or the directions of the petrous part. And then let us look at other important landmarks, which are the zygomatic process, the mastoid process, and the mandibular fossa. From before backwards, we have the origin of the levator villi palatini. Behind that, we have the inferior opening of the carotid canal. The jugular fossa is present behind the opening of the carotid canal. It lodges the jugular bulb. And behind that, we have the jugular surface, which is a rough area which articulates with the jugular part of the occipital bone. Now, between the jugular fossa, a little medially to the jugular fossa anteriorly, we have a triangular depression. This lodges the inferior ganglion of the cranial nerve 9, or the glossopharyngeal nerve. There are three important canaliculi in this region. We have the cochlear canaliculus here, and then the tympanic canaliculus, which is over here, and the mastoid canaliculus, which is over here. So these are the three canaliculi. The mastoid canaliculus allows for the passage of the Alderman's nerve, or the Arnold's nerve, which is a branch of the vagus. Two more important landmarks, the styloid process and the stylomastoid foramen, which allows for the passage of the facial nerve. Let's look at the features of the anterior border. The anterior border has two main canals which are seen as a single opening. Superiorly, the canal transmits the tensor tympani muscle, and inferiorly, the canal transmits the pharyngotympanic, or the eustachian tube. So those are the features of the superior or the anterior border. Let's go for the superior border now. This is the superior border, which is the longest border of the petrous tympanic bone, and it gives attachment to the attached margin of the tentorium. At the attached margin of the tentorium, we also have the groove for the superior petrosal sinus on its way to the sigmoid. Next, we have the posterior border, which is seen inferiorly here below the posterior surface, and here we have a groove for the inferior petrosal sinus. So the posterior border has a groove for the inferior petrosal sinus, and the superior border has a groove for the superior petrosal sinus. Now let us look at the structures or the canals which are oriented within the petrous part of the temporal bone. So as you can see, the external acoustic meatus is located within the petrous bone, and that reaches the middle ear. The middle ear, the pharyngotympanic tube and the mastoid lie in a straight line, and then on the medial aspect of the middle ear we have the semicircular canals, which are then connected in line with the internal acoustic meatus, which gives passage to the facial nerve and the auditory cochlear nerve. So that is the external acoustic meatus. Here we have the tympanum or the middle ear, which continues anteriorly as the pharyngotympanic tube, and posteriorly it forms the mastoid and the mastoid air cells. It is continuous with the mastoid space. Medial to that we have the internal ear components, the semicircular canals, and then the cranial 7 and 8 entering through the internal acoustic meatus, plus anteriorly it is related to the internal carotid artery. Now, what is the orientation of the facial nerve within the petrous? Let us place the three components of the petrous in order: the innermost part, the internal ear, the box-like middle ear, and the canal of the external acoustic meatus. So the facial nerve enters through the internal acoustic meatus. It passes through the fallopian canal or the facial canal, and it reaches the medial wall of the middle ear. From here it bends 90 degrees backwards, and this is called the first genu. It bends backwards, passing between the lateral semicircular canal above and the promontory below, and then it reaches the junction of the medial wall and the posterior wall. Let's remove the lateral canal and see how it goes. Now that is a better view. So now that it has reached the junction between the medial wall and the posterior wall, here it bends again. This is a second genu, and it passes on to the mastoid wall. From there it bends down. It is not such an acute bend, but it bends down and then it exits via the stylomastoid foramen. So through the internal acoustic meatus, it enters the facial canal and reaches the medial wall of the middle ear. There we have the first genu, and then the second genu, where it bends from the medial wall to the mastoid wall, and then curves down along the posterior mastoid wall, and finally it exits through the stylomastoid foramen. So these are the features of the temporal bone. I hope you enjoyed the class. Please stay tuned for more such classes in future. Thank you.